Welcome back, 7th grade virtual learners, and this is another edition of Too Good for Drugs. So, in our last lesson, we discussed the harmful effects of marijuana use on the body and brain. And the first question I want to ask you is, what is the mind-altering chemical in marijuana? And the answer to that is THC. Now, THC is introduced introduced into the body, and it blocks the brain's messaging system. Now today we're going to talk about two types of powerful drugs and discuss the harmful effects of their abuse. And these two drugs are street drugs and prescription and over-the-counter drugs. Now street drugs are drugs like cocaine, heroin, and meth. Drugs that most people know that are powerful, dangerous, and harmful to the body. And they're called street drugs because they aren't made in licensed laboratory or prescribed by doctors. They're usually sold in the streets. Now, what is a prescription drug? Now, a drug that's prescribed by a doctor and has legitimate uses in medical treatment. However, these drugs are too powerful to be administered and dosed by individuals. So, when writing a prescription, doctors consider several factors regarding safety and effectiveness of the drug. And what must a doctor know about the patient before writing a prescription? Well, one, they have to know the patient's weight. They also have to know if the patients have any allergies, the patient's age, and the patient's symptoms. Now, why might some people think abusing a prescription drug is less risky than abusing street drugs? Because most people think that because prescription drugs are prescribed by a doctor, they're safer. But there are labels and rules you have to read for prescription drugs. Now, today, you are going to be a doctor in a hospital emergency room. You will see 3 patients while symptoms and prescription of over-the-counter drug use. So you must determine the best treatment for your patient. So I want you to turn to page 22 and review the short-term effects of prescription, over-the-counter, and street drugs. Pay attention to which street drugs have similar side effects to those prescription and over-the-counter drugs, and use this information to complete each patient's hospital chart. Then, I want you to go to page 23, where it says, section titled, You Be the Doc. Now, for each patient, I will read a brief summary on why the patient was brought to the ER and the patient's symptoms. And then you will answer the question in your workbook to complete their chart. So let's start. We have patient number 1, which is Rachel. According to Rachel's mother, she was having trouble studying for a test in school. A friend of hers offered her a pill prescribed to him for his attention deficit disorder, a type of hyperactivity disorder. He told her the pills would help her concentrate. Now, Rachel's mother brought her to ER because she could not focus and complained of racing heart and couldn't sleep. And Rachel's chart indicates the following symptoms: anxiety, sweating, irritability, and paranoia. So use the information from Rachel's chart and the effects on page 22 to answer the questions to the number 1 on workbook page 23. So what type of prescription over-the-counter drug did Rachel take? She took a prescription stimulant. And prescription stimulants are prescribed to treat patients with hyperactivity disorders. And these drugs are designed to correct a chemical imbalance in the brain. Now, correcting an imbalance helps those with hyperactivity disorder focus. Now, prescription stimulants do not increase learning or concentration for someone not diagnosed with attention deficit disorder. In other words, it will not help Rachel study for or do better on the test. Now, which drugs have similar side effects as this medication? And those 2 drugs are cocaine and meth. So, let's look at patient 2, which is Marcus. According to Marcus' coach, he had a headache at football practice. His teammate Anthony offered him pills. His doctor prescribed for him for his pain for his knee surgery. Anthony said the pills really worked. Marcus took a couple of Anthony's pills. He brought Marcus to the ER because he was drowsy, confused, had slurred speech, slow breathing, and was vomiting. Use Marcus' information and the effects on page 22 to answer the questions to number 2. Now, what type of prescription over-the-counter drug did Marcus take? He took a prescription pain reliever. Now, prescription pain relievers are powerful opioids and are addictive. And remember that the appropriate dosage of the medication is based on many factors, including patient's weight, age, and reason for taking the medication. And the misuse of this prescription pain reliever produces similar side effects to heroin. And heroin is an illegal street drug. And like Rachel, Marcus was surprised to learn that misusing prescription pain relievers can produce side effects similar to those of street drugs. Now we have patient number 3, who is Chris. Chris was hanging out with friends. It was a rainy day without much to do. His friends started experimenting with drugs and dared Chris to try. Chris gave in to peer pressure. Now, shortly after, his friends called 911 because his friends said Chris complained of blurred vision and became dizzy, confused, and began throwing up. Then he passed out. They thought he was just sleeping, but they couldn't wake him up. So, what type of prescription or over-the-counter drug did Chris abuse? He just used DXM, also known as Dextromethorphan. And DXM is a cough suppressant, and Chris consumed a lot more than he recommended dosage of medicine. Now, the misuse or abuse of DXM produces similar side effects to which drug? And that drug is alcohol. Now, prescription over-the-counter drugs are safe and effective when taken as directed. Remember, medication that is safe and effective for one person is not necessarily safe and effective for someone else. And any prescription over-the-counter drug can be harmful and deadly as street drugs when not used as directed. So next week, we are going to do a review of everything we learned from Too Good for Drugs.